Hello, everyone. This is Simone Mitjans. I'm a marketing and mindset mentor for practitioners who wanted to take their practice to the next level and put their services and expertise in front of the right people. And I'm also the creator of the Profit Power Up marketing and mindset system. It's a 9-step to help you put your services in front of the right people. Today, I am so excited to share with you one expert, Dr. Mitchell Yass. I had the pleasure of speaking to him a little bit 2 weeks ago, and his work is extremely interesting, especially for people who are suffering from chronic pain. He helps people before they have surgery and even after they have surgery, if they don't still had surgery and don't feel any better. So I go through this with my husband. He had knee surgery. He's been suffering from knee pain for over 10 years now. And he did many different procedures that Dr. Yass is going to explain to you a little bit today. But nothing has really helped him to feel better, not even surgery. And when I came across Dr. Yass's work, I was so excited to learn more about it and then share with as many people as possible. So welcome, Dr. Yass, to our interview today. I wanted to start by asking you what inspired you to do what you do.
It was actually an evolution. It's not that it was a conscious decision. What basically happened was 25 years ago, I was 30 years old. I decided I didn't want to do what I was doing in my initial profession, my initial career, and I found out about this thing called physical therapy. I found out that I only needed a couple of courses to actually be able to apply to school, so I then applied. I got into physical therapy school and probably inside of the first week recognized that what had been is being promoted as legitimate mechanisms for addressing pain is completely baseless. In fact, the MRI, which is the gold standard for identifying the cause of pain, is actually a baseless mechanism. It is actually based on the idea that there's some correlation between the fact that you're having pain and then at the same time you're having pain, a structural variation such as a herniated disc or stenosis or arthritis is identified. And since the two occur at the same time, it means one is causing the other. This is correlative theory, also known as junk science. It's baseless. Mm-hmm. So I decided that I was going to have to establish my own mechanism for identifying what was truly causing people's pain. And I said, I just get through medical school and I get out and figure it out myself. And because I have a very, very strong weightlifting background, I've been lifting weights for 32 years. I am self-taught in the biomechanics and physics of weightlifting. I also was able to start associating the idea that pain was coming from muscle by also recognizing that there seemed to be movement pattern deficits. There were postural deficits along with the fact that pain was being experienced. So I correlated and related the fact that you were having these other symptoms with the pain, and it led me to believe and prove over the last 25 years that in 95 to 98% of cases, the cause of pain is muscular. I just thought of myself as a physical therapist with a unique perspective. I decided to write a book, which then led to some media, and over the next course of time, I started getting contacted from people nationally. And then eventually I did a PBS special, which led to me getting contacted internationally. And I saw a consistent thread globally. That is that just as like with your husband, a person has pain, they seek medical attention, a diagnostic test is utilized, a structural variation is identified and treated, the pain remains. And so I felt compelled that people have the opportunity to recognize that there is a method outside of the existing medical model that actually can accurately identify which tissue is in distress eliciting the symptom, and if in fact to be found to be muscular, which it is in 95 to 98% of cases, can provide a very quick and effective mechanism utilizing progressive resistance exercise to resolve that pain and allow the person to return to full function, exactly back where they were prior to when the symptoms began. So this has been an evolution, almost as if it was divine intervention that asked me to do this.
Yes, a lot of experts I talk to, that's what they feel. They feel compelled. They feel a calling based on what they see. When they see there's a problem, and they see methodologies that have not been helping or working and are senseless, and they all of a sudden have this light bulb. Wow, but what if we look at this? And they create their own methodology, like you did, the Yass Method, and they start applying and seeing results. And so a little bit of your educational background, you're a physical therapist.
Yes, I have a doctorate in physical therapy, but I want people to really understand that I differentiate myself from the physical therapy profession. First off, people should understand that physical therapy, the practice of physical therapy, developed after World War II when guys came back and they needed rehabilitation. Physical therapy was actually derived from nursing. The first physical therapists were nurses. Then it shifted to a unique profession called physical therapy. So I want people to understand that although my doctorate is in physical therapy, you must understand that my methodology sits outside of physical therapy. It is the next extension beyond what the existing physical therapy practice would be able to employ. That's the important thing to understand. Right. Just because someone has a credential doesn't mean that that justifies what they're capable of or what they're promoting. I am promoting something completely outside the medical profession, so please understand that.
Right. So help us understand what exactly is the Yass Method.
Sure.
How is it different from physical therapy, and how does it help people?
Sure. There are certain key components that must be understood that have been completely avoided now that the MRI has been implemented. Number one, pain is an indication of a tissue in distress. You have pain just like any other symptom because the body is trying to create awareness that something's not working, and it's the very tissue that's in distress that elicits the symptom. Number two, that symptom occurs at the inception of distress of the tissue. So if your pain began 2 weeks ago, it means the tissue in distress must have gone in distress 2 weeks ago. Now, when you look at the existing system, it simply employs medical diagnostic tests, MRIs or X-ray, and to find structural variations. The implication being that just because the structural variation occurs can be identified for the first time at the time the symptoms beginning or existing, it must be the cause. My point to everybody, which is clear, is the fact that these structural variations take years, if not decades, to develop. Arthritis doesn't occur in 2 weeks. Herniated discs don't occur in 2 weeks. Stenosis doesn't occur in 2 weeks. Pinched nerves don't occur in 2 weeks. Therefore, there's no possible way that those structural variations that are identified are creating the symptom. If you were taking an MRI a year, if not 5 years prior to your symptoms, those structural variations would have been identified. Okay, so it's important to understand that just because this MRI is finding that structural variation doesn't mean it's the cause. The other point that must be understood is that this idea of structural variations requiring intervention simply because they're identified is a cultural precept. It is not medical. There's nothing indicating that. And that can be seen by the fact that a study showed in over 90% of people with no back pain over the age of 60, 90% of them were found to have bulging or degenerative discs. 90, not 9. And is that, oh, I hope you're still there. Okay, you're still there. Sorry about that. What's important to understand is that if these were causing pain, how could 90% of people with no pain have them? So we have to begin to recognize that this treatment of structural variations is actually cultural. It's not medical. So what makes the Yass Method unique is that I have gone back to the old 1950s, 60s, and 70s mentality, which is to say that if there's a symptom being created by interpreting the symptom, I could identify which tissue is creating that symptom. Whether it's a bone, a muscle, or a nerve, each one creates a very specific symptom. Therefore, you can then identify which tissue it is by interpreting the symptoms. If in fact it's muscular, you could recognize that there are also going to be, as I said before, postural or movement pattern deficits. So if you're limping and you have say ankle pain, or you have back pain or hip pain, you have to associate the limping aspect with the pain and say, well, what tissue would this be associated with limping and pain? You're going to have to assume it's muscular. If you're a person who says, oh, I have back pain, and if I sit for a while and I go to stand up and I have writhing back pain, that's a movement. Standing up is a movement. If you see that your back is arched, that's a postural variation. These must be recognized as symptoms associated with the pain, which is telling you again, the tissue is muscular. The important thing to understand is that there is a muscular deficit will never show up on the diagnostic test.
Yeah.
No muscular deficit. And there is no medical specialty educated or trained to identify muscular causes. Therefore, if you acknowledge that somebody has a muscular deficit causing their symptoms, there is no possible way for that to be identified if they seek treatment through the medical system. That's why the Yass Method is the only legitimate mechanism you have to identify the cause of your pain. That's what makes this so unique. And its effectiveness is absolute, based simply on its theoretical basis.
Yes, yes. And I hear your passion. You're passionate about what you do, your passion for what you do. And I would like to hear from you that where this passion comes from. What have you seen people walking through the door?
Yeah.
That has pumped you to really be passionate about what you do? What have you helped clients or patients with?
Sure. So number one, I am a logician basically by mindset. My father taught me analytical thinking when I was a boy. So anything I do is based purely on logic. This idea that because I was taught something through a medical system means nothing to me. If it's baseless on logic, it doesn't mean anything and it's invalid. I wish the rest of the medical system would simply recognize that, but unfortunately, I think it's too far down the road. Number two, if you knew for sure, absolutely, irrefutably, that this methodology that you had can allow people to reverse the pain that they've been suffering from and give them the lives back that they so richly deserve, and you knew for sure you had that ability, you would certainly want to do everything in your power to give this gift to people so that they could have the lives that they choose. Right. Now, I've been doing this for over 25 years. I've treated over 15,000 people. Name the level of dysfunction or emotional distress that people can have, and I've seen it all. I've treated people who were suicidal. Straight out told me, you don't get this done, you're my last hope, I'm putting a bullet in my head. I'm not waking up tomorrow. I've treated people who have actually been divorced based on their situation. I have had people who can't keep a job. I have had people who are addicted to pain medication because of this. I have seen bodies and lives destroyed because of pain. Mm-hmm. If you recognize, remember what I just told you, pain begins at the inception of distress of a tissue. Therefore, if in fact the proper identification of the tissue and the proper treatment is provided, doesn't that mean by definition pain should never be anything more than acute? The only way it can become chronic is through misdiagnosis. It's by definition. This is just pure logic. This isn't medical. This is just logical analysis. Right. The only way pain persists is if the wrong tissue is identified and treated, and therefore the tissue in distress remains in distress, emitting the pain signal that people are experiencing. Right. If you knew that for sure, and you had the method to identify that tissue, how could you, in good moral conscience, not go out and yell at the top of every roof, I have the answer to resolving your pain? I've dealt with 6-year-old children to 102-year-old people. I've dealt with every type of level of person that exists. I get contacted. I just did a Skype evaluation from someone in Perth, Australia. I get people contacting me from every place, India. Name a place on earth, I get contacted from it. The reason is because people are fed up, have recognized that the existing model doesn't work. You have told me about your husband and the level of depression he's reaching. It's a sad state. This is horrible. It's horrible. And the thing that upsets me most is the fact that it's so simple to resolve if you understand the mechanism to diagnose the tissue in distress. That's what this is all about for me. It is literally an attempt to resolve, eradicate chronic pain globally.
Phenomenal, phenomenal. I live, like you said, you have come across so many people in distress. My husband has been in pain for over 10 years. Luckily, he does not take painkillers because it makes him feel very, very sick.
Sure.
So the poor thing has been taking the pain for so many years and how it affects people's lives. We have had 1 year, I was insisting that we would go on vacation. He doesn't want to walk long distance.
Right.
He's impatient easily, out of pain. I can't relate because I'm not in his body.
Sure.
And one of the things that really he shared with me that broke my heart, he said, honey, you don't understand. The ocean, you go and you walk on the sand, it's unstable. And the waves, hitting your legs, my legs, I feel like I'm going to fall. And that for him must be something hard to deal with. Like I'm going to, he's a 58-year-old man now, 6 feet tall, he's a big guy, and just to be falling because he can hold himself up. So that I was like, wow, why didn't you tell me that before? But I know there are a lot of people, they're suffering by themselves. They can't even explain to their family members how they feel.
Sure.
Because a pain is not something that we can see.
That's right. Right. That's to me, the biggest point to understand is that if you have cancer, if you have some type of disease entity, it is basically accepted. If you have a heart attack, you're allowed to stop your life. Oh, that person had a heart attack. Please take as much time away from work. Oh, honey, you don't have to worry about taking out the garbage. Oh, don't do the lawn. Don't have to. Because it's accepted that this is a traumatic event, something that needs time to recover from. No one sees pain. No one sees pain. It's not something that can even be diagnosed through a diagnostic test. You can't point to pain. So as a result of that, no one really understands, unless you're living in pain, how it affects you. And it affects you globally. From every moment you are awake, that is affecting you. You don't want to interact with people. You don't want to do things. You don't want to engage. What's so scary is that the pain affects your ability to think. If you go on pain medication, that makes it harder to think.
Right.
It makes it even harder for you to concentrate. You have virtually no option. And if you continue on day after day, the sense of hopelessness, the sense of never seeing the light at the end of the tunnel, that's something that can take people down to the lowest levels of emotional distress that they just say to themselves, I just don't even want to wake up tomorrow and have to deal with it again. It's horrible. I've seen it all. And I've been doing this for 25 years. I've been doing this a long time.
Right. So basically, this is the kind of a path he's been going through. And especially on your legs, because you have your whole body weight.
Sure.
Plus gravity, plus whatever it is, blood flow more when you stand up towards your legs. So it is, I know he's not alone. You have met many people who are even in a worse scenario, like you said, being addicted to painkiller. We did have, a bad episode, but I never really connected the emotional breakdown to the pain.
Right.
Not in a million years. It was what showed up was extreme depression and anxiety. So I have also watched some of the testimonials, the video testimonials you have from people you have helped. Would you share with us maybe 2 or 3 before and afters? How have you helped people specifically? Like, did they have back pain? Did they have hip pain or knee pain? I know my husband was told he was bone on bone, and there is a specific video on your YouTube channel about this diagnosis of being bone on bone, and you explain beautifully how that is not even possible to happen.
Right.
So let's start with the bone on bone diagnosis. How have you helped patients with that? Mm-hmm.
I mean, I literally can, it's in the thousands of people. I need people to understand that the people you're seeking your medical attention from may be the nicest people in the world. They might have the best intentions in the world. But if they're educated, and it has been going on now for over 40 years, to believe that a diagnostic test is the absolute truth when physical presentation doesn't matter, you have to recognize there's a high probability that you're going to get a false diagnosis. So the common thing that you're referring to with the knee is that someone has pain, let's say around the kneecap. Right. Most people have pain around the kneecap. This is the best way to explain this. Most people have pain around the kneecap. They go to a doctor, an orthopedist, an x-ray is taken, and it shows that there's a decreased joint space between the thigh bone and lower leg bone. And you're told that you're bone on bone. And the presentation to you is, you see how there's less space there? They're going to say it's no space. Okay? But the fact is, no space means zero joint space. And for that, you would have to have a major loss of range of motion. And at this point where I can't bend your knee anymore, it would feel like a bone's hitting another bone. In the thousands of cases I've treated people were told they were bone on bone, 2, maybe 3 actually were bone on bone. Everybody else was not bone on bone. They had muscular deficits, and I was able to resolve their pain muscularly. But let's just go on with this concept. You're told you're bone on bone, which occurs between the thigh bone and lower leg bone. Your pain is around your kneecap. You need to understand that the joint between the kneecap and thigh bone is separate from the joint between the thigh bone and lower leg bone. So whether you're talking about a degenerative meniscus, a torn meniscus, or this concept of arthritis or bone on bone, right, at the joint between the thigh bone and the lower leg bone, it can never create pain around the kneecap, period. So if you have pain around your kneecap and you're told you need a knee replacement, a joint replacement because you're bone on bone, that's simply an impossibility. It could never be. So what happens is people come to me, they hear I have the capacity to diagnose, I see that their pain's around their kneecap, and in most cases it's simply your front thigh muscle, your quad is too strong in relationship to your hamstring, and since that's attached to your kneecap, it pulls up excessively on the kneecap, causing the kneecap to become compressed. When you bend your knee, that's what causes your pain. So all you need to do is stretch your front thigh muscle, strengthen your hamstrings and butt muscle, and within a week, you could be out of pain and fully functional. It's that simple. But there has to be an understanding of the mechanics of the joint and where pain actually can represent as a symptom what could possibly be eliciting it.
Yeah, I'm on your website and I'm looking for your book. So that's the bone on bone.
Correct.
Yes, and that's the reason why even after all the different surgery procedures, including
correct
injections, right? Injections in the knee.
Yes.
And then you have partial knee replacement. Then you have full knee replacement. So all that progresses.
Correct.
And it's still, the pain is still there. So that's one of the reasons why. So what else have you helped? What other kind of pains have you helped your patients with?
Sure. So let me give you one of the biggest misnomers that exist relating to the back. There's this theory that scoliosis causes pain. Scoliosis simply implies curvature of the spine. Now, the general preposition that is tried to be promoted is that, well, scoliosis is causing pain, which implies that the vertebrae themselves are eliciting the pain. That's why the idea of scoliosis is treated by the medical system by putting rods in people's backs.
Right.
What you need to understand is that bones can only elicit pain if there's fracturing. A bone will only elicit pain if it fractures. And in the case of scoliosis, there is no fracturing. It's simply curvature of spine. Therefore, the idea of scoliosis causing pain is just baseless, meaningless. It doesn't mean anything. It's just something that's promoted and, again, culturally accepted. So I had a patient who for 40 years had a progressive scoliosis. 40 years. Wow. Progressive scoliosis. She continues to have back pain. She gets on pain medication. She's on pain medication for about 10 years. Eventually, it simply cannot diminish her pain anymore. She is told that she needs a rod put in from her skull to her pelvis. She is told that this is such an extreme surgery that they're going to have to bring in a heart surgeon to actually stop her heart to allow them to get this rod in. She's told she's going to need to put on 60 pounds of fat because for the next year after the surgery, she is going to be bedridden. She will be in that much pain. She's going to have to live off of her fat. So that's how extreme the situation is. She comes to her mother, who happens to be in South Florida when I was living there, and she finds out about me. She presents herself, and I recognize that just as I tell everybody, scoliosis is a symptom, not a cause, but a symptom of weakness or imbalance. And it is, in fact, the weakness or imbalance of the muscle that's causing the muscle to strain and elicit pain near its attachment to the spine. So in her very first treatment, this is after 40 years of progressive scoliosis, I treat her muscles. I establish what the muscular deficit is. She has less pain. 3 months later, she's off all pain medication. 6 months later, she has no pain. She actually lived in Indiana. She would come back and forth for a couple of, probably over a 6 to 8 month period. And by the time we were done, she was able to single ski, water ski. That was her passion and her dream, to eventually go back and be able to do that with no symptom whatsoever. She sustains her exercise routine. She has not had pain again. She has the quality of life and the level of function she desired, all because the appropriate diagnosis was given. And she stepped away, was willing to step away from the entire medical system's cultural precept that scoliosis causes pain.
Wow. Yeah. So we understand that everybody's doing the best they can with the training they had.
Correct.
Nobody's here to go after doctors or anything like that. But unfortunately, the trainings, it's just like when I was training health and wellness and nutrition, we can solve so many things, bringing our body back to balance with nutrition. We didn't need surgeries. We didn't need fertility treatments. As long as you put the proper nutrition, which is a no-brainer. Your body's designed for protein, healthy carbs, a little bit sugar, water, healthy fats. Like, it's a no-brainer. Why are people wasting so much time talking about anything else than just putting the right food in their bodies?
Yeah.
So, but unfortunately, a lot of doctors do not receive nutrition training. They're trained to help people in crisis, and the methodology that is available, it's not working. It's, for some people.
It's so unfortunate because it starts so early with people. You're told that people have scoliosis all the way, like, right in high school, and it's this cultural nonsense. It's just festered in a person's brain. Oh, it's something, I got to address it. I got this idea. There is such a false premise that scoliosis, stenosis, arthritis, that these things, this is where the biggest problem lies, is that people have been culturally programmed to see these things like cancer. Oh, if it's identified, it requires intervention. People have to recognize these things are developing slowly and progressively. It's not affecting your body's function at all. They don't elicit symptoms. They're like wrinkles. Nobody goes and gets a skin graft every time they get a wrinkle.
Right.
The reason is because there's a recognition culturally that the health of the skin is still intact, even though there's a deformity to it. Even though it has been altered, the structural integrity exists. The same thing can be said for arthritis, herniated discs, stenosis. It's all nonsense. It is cultural that these things require intervention. There is nothing medical, not one iota of medical fact that says they require treatment. And it's obvious when you see 90% of the population having the same structural variations and not having symptoms. If these things do cause symptoms, why do these people have the same structural variations and don't have symptoms? And the reason is because they don't have symptoms. And when you do have pain, it's simply another tissue, in almost all cases muscle, eliciting your symptom, and you're simply identifying that structural variation at the time you have pain. But it's not to say it was causing the symptom. It's not to say it will be there. It was there before the symptom, and it's not to say it won't be there after the symptom, because it will be.
Could you share a little bit about your book? One of the videos I was watching on YouTube, on your YouTube channel, one of your patients, she shared that she saw one of your series on PBS, and she ordered your book, and she couldn't put your book down. And one simple exercise or something, recommendation you put in the book, she did it, she followed, and her pain diminished.
Yep.
I'm not sure how much percent, but it was impressive. So much so that she shared. So tell us a little bit about your book.
So I have 3 books. The first one is Overpower Pain. The second one is The Pain Cure RX. And the third one is the Yass Method for Pain-Free Movement. Overpower Pain was written back in 2008, and it was the premise that I wanted people to simply accept the fact that pain was muscular. And so I went joint by joint and tried to show the most common muscular deficit that elicits pain at each joint, and then I present the exercises to resolve that particular deficit. In the Pain Cure RX, I felt I had a responsibility to provide the evidence why the existing medical model doesn't exist. And so I give you all the theoretical basis why MRIs are baseless, X-rays are baseless, how you would actually know the symptom that would be associated with this structural variation. In the 2 to 5% of cases that it is that, you would want to know what the symptom is, because you still would want to have those addressed if in fact the structural variation was causing your symptom. So I present that. Then at the primary areas where people have pain, the neck, the mid back, the lower back, the shoulder, the hip, and the knee, I describe every possible muscular cause that can create symptoms. So that's in the Pain Cure RX. And again, I show the exercises to resolve it. I wanted to try to go a different direction for the newest book that just came out, which is the Yass Method for Pain-Free Movement. And I wanted you to recognize that most people have acknowledged and come to the realization that pain begins when they try to do an activity. I can't tie my shoe because I get pain in my thigh if I go to try to raise my ankle and put it up. So the Yass Method for Pain-Free Movement looks at all the movements or activities you need to perform. And in doing those activities, you're going to see that there's only 2 or 3 exercises you would need to do to resolve those symptoms and allow you to perform that activity again. So the Yass Method for Pain-Free Movement is simply going to take you from the time you wake up to the time you go to bed. You're going to pick the activity you're having a deficit with, see the exercises that need to be performed, and then do those exercises. Within a couple of weeks, you'll be able to do that activity. And hopefully it will prevent you from feeling that you need to seek medical assistance, which will lead you down this path of improper diagnosis. That's what makes this book so unique. It's going to address the specific functional limitations you're having.
Phenomenal. Phenomenal. Now I'm curious. I'm going to be getting those books. My daughter's, like I shared with you, my daughter too is having hamstring problems from growing really fast. I don't know if that is really the reason, but she grew a lot, and she's in cheerleading and gymnastics. I'm not sure if a combination of all of that really did it to, so she has a limited range of motion on her right leg. So I'm going to be looking for that book and talking to you too. The next thing I would like to hear from you, you've been doing this for 25 years. What is some of the one challenge that you had in the beginning of your practice and how you overcame that challenge?
I think the biggest challenge I had was differentiating myself and this methodology that I have versus the unfortunate credential that I hold. I would say I have lost thousands of opportunities to resolve people's pain, because as soon as the person who came had their pain resolved in just a week, told their relative or their friend or their coworker, I found this guy who can resolve my pain. And they said to them, oh, so what degree does he have? And they said physical therapy. They said, oh, I'm not going to go to that. I've already tried physical therapy. It doesn't work.
Oh, right.
So, oh, it's in the thousands of cases.
Right.
So differentiating myself as having a unique methodology, which sits completely outside, forget physical therapy. It sits outside the entire medical system.
Mm-hmm.
That was where the greatest problem was initially.
Mm-hmm.
But then through word of mouth, 99% of my patient load has always been through word of mouth, never through referral or prescription or any of that type of stuff. And then media that I started to receive. That's what started to develop the awareness. And as I said today, I'm contacted from all over the world. I have enough information out on YouTube, my books, my website. There's enough out there where just through the simple use of Google, people find this and people recognize there's something unique once they have the opportunity to understand it, and they seek the care. So
Right.
that's really not an issue anymore. I would wish more people could find out about it, though. I
Right.
wish I had a better means of getting, just so you could understand, chronic pain is the largest health issue in the world. It roughly affects 130 million Americans and roughly 1 billion people worldwide. There's a lot of people out there seeking an answer to their pain, and I would like everyone to have access to this method.
Right, right. The book will definitely help people to have access to that. And
Sure.
I'm looking at your website right now, and I'm reading, if you're suffering from chronic pain, this is the book for you. And this is recommended by Dr. Deepak Chopra. Also, he's a medical doctor, and he's well known in the wellness industry, health and wellness industry.
Mm-hmm.
So you have great endorsements. Also, yeah, differentiating, that's something, it's crucial. So people won't associate you to one thing or another. Maybe it's good to give a little reference as a reference, but then let them know what you really do. But I can see how people be like, oh, okay, I already tried physical therapy, and then just be like, they don't hear anything else after. So
Sure.
it's important to educate your patients, to teach them how to talk to their family and friends, so they, it can be helpful for them as well. And now, after 25 years in practice, what is something that you see would be, let's say, a challenge or an obstacle, just as a result of being in practice? And
Well, the primary issue is getting paid. Now that's become the biggest issue. And that's simply the fact that I don't think people understand this. In the United States, you have a health insurance crisis. That's what led to Obamacare and all this other stuff that's gone on. What people don't understand is that costs of healthcare didn't go up homogeneously. In fact, the cost of cardiovascular care has to have gone down. The cost of cancer care has to have gone down based on the incredible advances made. The thing that's gone up is the cost of chronic pain. It went from 70 billion to 635 billion in 10 years. That excessive amount of cost cannot be overtaken by the amount of premiums paid, whether you're being treated for pain or not pain or having or no symptom, simply by putting premiums in. That's what has led to the fact that premium costs have gone up, deductibles have gone up, and the cost, the actual payments made to practitioners has plummeted. And that's one of the reasons why you're seeing fewer and fewer people entering the medical system, fewer and fewer people taking insurance. Practices are now going to cash-based systems. So what's happened is, without anyone even recognizing, even if you've never had chronic pain, you've been affected by chronic pain. So that's where the problem lies. And the fact that the existing system failed so miserably, still, as long as people don't recognize that there's an alternative, which is the Yass Method, unless people recognize that there is an alternative and they continue to use the existing medical model, they don't see that
just doing the same thing over and over again is not going to lead to any different result. That's why the person gets 6 hip replacement revisions, gets 5 back surgeries. It's illogical for anyone to think that that's a coherent thought process. But when you don't recognize that there's an alternative, your attitude is, well, at least I'm trying to do something. I had a woman who I treated. She said she went for physical therapy for 27 years. 27 years. I said, why would you possibly do that? Why would you go through it? Knowing it hasn't worked up to that point. Her answer was so profound. She said, well, I knew if I did nothing, it wouldn't go away. So I figured at least I would do something. Mm-hmm. That's the reason people seek medical attention with the existing medical model. The failure rates for surgery are horrible. The medical system creates the diagnosis, failed back surgery syndrome, to account for the fact people have the same pain after the surgery as before the surgery. That's the medical system's attempt to address the fact they're doing surgeries and not getting any result. You have 22 million Americans suffering from chronic pain. Suicide rates are going up. Clearly, the system is failing, and yet everyone continues with it. Why? One reason. They don't see that there's an alternative. And the medical system doesn't attempt to provide an alternative.
Right.
So that has to change, and that's why I hope doing shows like this help people to become aware that there's a logical alternative, which is much more focused on the idea of connecting your symptoms with the tissue eliciting your symptoms and resolving it when it happens to be muscle in a simple fashion.
Right. And well worth the investment. A lot of professionals, you were talking about getting paid was a challenge now. Was that what you said?
There's no doubt about it. You have many medical practitioners who are leaving insurance completely and making it be cash based.
Right.
They have no alternative.
Right. Yes. In fact, all my clients are fee for service only.
Right.
Yes. I actually am releasing a article. It's already on my blog. It's how to market your fee for service private practice. And trust me, people will invest in their health once they know they can feel better, because what they've been doing isn't working. And a lot of times, even whatever is covered by the insurance is still not being effective. So they are willing to invest. I came across a practitioner, and I asked her, what is your story? How come what inspired you to do what you do today? And she said, my own health and wellness challenges. I was going to get conventional treatments and wasn't working. And I asked her, why did you decide to invest out of your pocket to go into alternative health? She said,
right.
Because they had different diagnoses, they had different testings and things that worked better for me. So there's plenty of people out there who are willing to invest in their health and well-being. They just don't know where the solution is.
Correct.
So, doing these interviews, like you said, writing and doing your blog and helping people to learn about you and your methodology, and especially because through your books, as you shared, people already can get so much value and right there from reading your books, and plus connecting with you. So I wanted to thank you. And before you go, so just let everybody know where they can find the name of your book again and where they can find you.
Sure. So my 3 books are Overpower Pain, The Pain Cure RX, and the Yass Method for Pain-Free Movement. My website is www.mitchellyass.com, MITCHELLYASS.com. And I'll even give you my email address, which is drmitch@mitchellyass.com, drmitch@MITCHELLYASS.com. I am always available. As I said, I think this is more of a quest or a journey that I'm performing. I don't see this as a job or an occupation. And I truly believe that my responsibility is to respond to anybody who seeks me out, who's searching for an answer to their pain. So If you want to contact me, you can certainly contact me through my email, and let's see if we can help you resolve your pain. As I've made it clear, and it is irrefutable, chronic pain should not exist. Pain should always be able to be resolved in the acute stage. If it's chronic, it can only occur for one reason. It can only sustain due to misdiagnosis. You need to get the right diagnosis, and that's what the Yass Method affords you. The Yass Method is not necessarily just a treatment mechanism. It is a diagnostic model, a way of getting the proper diagnosis. That's what separates us from anything else that's out there.
Thank you so much for the work that you do and all the people that you help. And thank you for your time in sharing your expertise with us today. Until next time, bye for now, everyone.